Hey everybody, Dr. Dave here. Why has there been no clear consensus from doctors about treatment for COVID-19? I'll give you my thoughts on that right now. My initial plan was to do a video on treatment options for COVID-19, such as hydroxychloroquine, but it became clear to me fairly quickly that I needed to do some sort of a preface on this. So this video is going to be a little bit different. It may not be quite as helpful, but I hope it's at least interesting to hear things from my perspective here. As a side note, the next video up is one about hydroxychloroquine. I get asked about that all the time, so if that interests you, make sure to hit that subscribe button so you're the first to know when it comes out, and tell all your friends. I do feel like it's important to start off with a statement just to let you know where I'm coming from. So I am a clinician. I'm not a researcher. I don't have any affiliation whatsoever with any pharmaceutical company or political agenda or anything like that. I see patients, and it is every intention of mine to take the best care of my patients, and I really want to provide them with good options during this pandemic. That being said, I do get asked a lot of questions during this COVID-19 pandemic, and as I do my best to respond, I find myself saying something like, "We're doing our best to figure this out as we go along." And that's true. We are doing our best to figure this out and provide the best care we can. But at the same time, I hate saying that. After a lot of training and 12 years of experience of internal medicine, I'm used to having some answers. But now things are different. People are desperate for answers during this pandemic, and they're fervently looking to their physicians. They're looking to me for those answers. I'm finding that I have little concrete answers to give. I'm used to having the weight of evidence-based medicine behind me, and we'll talk a little bit more about what that means in a minute, but now I find myself in much more uncertain waters. There's a lot of data coming, and it's coming from a bunch of different directions, but it's hard to separate the good from the bad, the true from the false. Let me explain a little bit the predicament we're in with medicine right now. So a lot of research is going into the care of the critically ill. So these are the folks in the hospital on ventilators with oxygen needs, things like that. Comparatively little research has been done for treatment options as an outpatient. So these are people who have COVID-19, but they're not sick enough to be in the hospital. Some of them might progress to get sick enough to be in the hospital, but until then, they're under my care. So here's the problem. How do I treat them? Let me explain a little bit about how medicine should be practiced, and then we'll talk about why things are so different right now. So earlier I alluded to a concept called evidence-based medicine. So what you're seeing right here is obviously a triangle, and it's called the evidence-based triangle or the evidence-based medicine hierarchy. Not all studies are created equal in terms of how helpful they are in making medical decisions. We could get a lot into the different types of study designs, but I really want you to stay awake for this video. So suffice it to say that the types of studies that are at the bottom of the pyramid tend to carry less weight or less power in helping us make medical decisions. The types of studies at the top of the pyramid are the ideal ones. These are the ones that are designed in a way that really help us make good, strong, comfortable, confident medical decisions. Ideally, when I'm treating my patients, I'm going to look for studies that fall within these top two categories, either randomized controlled trials or systematic reviews. Listen, if we're being honest, this is the way you want your doctor to practice medicine. Now, don't get me wrong. I don't mean for a second that medicine should be cookie cutter or one size fits all. The best doctors are able to take all of this medical data and information and still be able to apply it to you. They're able to individualize it to you and consider all the aspects that make you, you. But there has to be a balance there. You don't want your doctor to individualize things so much that they really go off the beaten path and they forego all of this data that has shown to be safe and effective. When you think about a new medication or therapy, you also don't want your doctor to just jump all in and be all about it when they haven't carefully consider the research that's gone behind it, and even consider whether enough research has gone behind it. Done correctly, a physician can draw on all of the knowledge generated by all these high-powered studies, and then they can apply that knowledge appropriately to each individual. So this feels right. This is the way medicine should be practiced, and I really want this for my treatment of COVID-19. But I don't have it. There are many treatment options that people are considering for early treatment of mild to moderate COVID-19. Hydroxychloroquine, azithromycin, zinc. How about vitamin D? Should you get an MMR booster? Some of these are interesting and the mechanism of these show promise, but we don't have that weight of evidence that we usually do. Now, there are some randomized controlled trials out there, But it's different. We don't have the years and years of data, years of experience, and years of research to go behind these decisions. We eventually will, but this takes time. So what do? One answer is to wait. Eventually we will have all that data. And then when that happens, I'll be able to approach my patients with confidence and give them the treatment option that I know is going to work best. This does feel right. This satisfies my desire to not just give any treatment, but give the correct treatment. This also satisfies the oath that I took to first do no harm. And finally, I just have years of training and experience that point me in this direction, that this is the right way to go. But if I'm perfectly honest with myself, and I'm going to be honest with you guys, there's another part of my brain that's being just as vocal, that it really doesn't feel right to wait. While we wait, what is going on? Thousands of people are still getting this virus. Some of them will get very sick and some of them will die. What if medical history looks back on this era that we're in right now and kind of shakes its head and is like, man, they really should have started treating with fill in the blank much sooner. And besides the medical side of things, there is so much other suffering going on. There's social, there's economic, there's psychological, there's educational. COVID-19 has really turned this world upside down. And we all know how scary the upside down can be. So what are my two basic options here? On the one hand, I can wait. Medical research will eventually give us the data that we need to make good decisions about treatment. In the meantime, we do our best to slow the spread of this virus. We wear masks, we socially distance, we wash our hands a lot, and we make careful decisions about things like sports and school and things like that. This will ensure that we do not provide treatment that is unsafe or ineffective. Now, this decision feels right. For reasons I mentioned before, it just feels right, but at the same time, it doesn't feel right. On the other hand, I can go out of my comfort zone. I can try some of these treatment options that have shown promise. Now, we'll have to do this carefully and we'll have to analyze the data as it comes in real time, but we could potentially have a lot of benefit here. The downside is that I could be giving treatment to my patients that are ineffective or even unsafe. Now, this option feels right. I'm doing something. I'm not just waiting. But at the same time, for a lot of reasons I mentioned before, it also doesn't feel right. To be quite honest, this dissonance, these competing strategies, feels uncomfortable. I do think some of these treatment options have promise, but I also do not like feeling that I am experimenting on my patients. In an earlier video, I mentioned using something called the risk-benefit ratio to help us make decisions. Now, how am I supposed to have this conversation with my patients if I'm not really sure about what the risks are and I'm even less sure about what the benefits are? On the other hand, what do I tell my elderly, vulnerable patient sitting in front of me who is just diagnosed with COVID-19 when she looks up at me and she says, "Doc, is there anything you can do to help?" Listen, at this point, I feel like I need to be clear about something. If there was a treatment option out there that was clearly pulling ahead as being safe and effective for treatment, I would be using it. I have no interest in withholding that type of treatment from my patients. The fact of the matter is that it's not just that clear. There really have not been any treatment options that have pulled ahead and shown that kind of clear promise. I really appreciate you taking the time to watch this video, but if you were hoping for the grand answer at the end, I'm afraid I'm going to have to disappoint you. I have conversations all the time with my colleagues and my friends who are doctors, and we sincerely are trying to incorporate all this data as it comes and make the best decisions. In addition, there's typically strong pressure from patients to consider these treatment options, but there's strong pressure from the medical community to wait and to use these treatment options only in the setting of a medical study. As a few final thoughts, doctors should be decisive. An unsure and indecisive physician really doesn't inspire much confidence, but I fear that our profession has really been indecisive during this COVID-19 pandemic. And for that, please forgive us. But if I could also ask you to be patient with us, no pun intended there. The vast majority of us really are trying to wade through all this noise and clutter and politics to make the best decision for our patients. And we do feel the pressure of time as this pandemic keeps going on. After all, we are doing our best to figure this out as we go along. Thank you so much for watching this video. I hope that you found it helpful and interesting, and if you did, please leave it a like. Now don't forget, this was a preface, an editorial kind of video. The next one up is going to be about hydroxychloroquine and its use for COVID-19. So if that interests you, please subscribe and hit that bell button so that you can be notified as soon as that video comes out. The support that I've gotten for these videos has truly been amazing, and I sincerely thank all of you for that. And I'll leave you with one final thought. Just remember that kindness, that's always the best medicine. You guys take care.